Okay, we are recording as always. And so let's jump in and get started. Give me 1 second here. Okay. Well, again, welcome again to our task force meeting. Wanted to, again, as always, thank our sponsors, Care First Health Plan, Valley of the Sun United Way, Satellite Broadcasting and Communications Association, Khajiit Triad Wireless, and Karen Ziegler Consulting Services. And we do need sponsors ASAP, if not yesterday. So with that, do we have any new participants today? Other than Alan, you're going to be introduced a little bit later. We have anybody else who's new today? Take that to be a no. Okay, well, we have a lot of things on the agenda if our folks show up to participate. So just a reminder that after our meeting that we try to do kibitzing with colleagues, and that's just an informal gathering. We turn off the recording and just allow people to kibitz, to talk, share information, ask questions, etc. So you're all encouraged to participate. I don't think I saw Janet Major on the call yet. Maybe she will be here, but I did want to congratulate her that she's been named a fellow of the American Telemedicine Association. So I'm assuming that's a great honor, and congratulations, Janet. And maybe you will still join us yet today. So moving on, I'm going to wait a little bit on a couple of things, and hopefully Sandeep is going to join us in a little bit. So Elena, while we're waiting for them, why don't you share what you wanted to share regarding your lessons learned regarding the ACP pilot awareness program. And do you want to share, Elena?
Yeah, I can. I just have one slide. I wasn't going to do the whole presentation.
Okay.
I just have one slide. So
okay.
I can
well,
share
I will stop sharing and let you share.
Okay. Hang on. Can you see that?
Yep.
Okay, let me make it bigger for y'all. Okay, so most of you on the call already know that Common Sense did a 12-week pilot program mostly in Phoenix. Some of Maricopa County was included because of the fact that we did marketing and advertising that could not be targeted as easily as some of the other types of advertising, billboards, what have you, light rail, things like that. So I didn't realize, I didn't know, Steve, if there was going to be new people on the call, or I mean, I feel like I've talked about this before, about the pilot itself, so I wasn't going to go into go ahead.
Well, Elena, yes, most of the people have been on the call before, but we do have a couple of people in particular who are presenting actually today that may or may not know about your outreach, and so it's certainly relevant to our overall discussion today. So maybe you want to provide a little more detail.
Yeah, so the pilot that we did it started off as being an awareness pilot program. We learned very quickly, and this was back in August, so we learned very quickly that it also needed to be an enrollment campaign as well. And so we partnered with the Digital Equity Institute, who through them we were able to go to ASU. They have what's called the Experience Center, which is really their tech hotline that was initially for students and faculty. And obviously it would be like an IT helpline. Because of COVID and because of everybody at ASU, including faculty, myself included, we're teaching online. They had to sort of turn their experience center outward into the community. And by doing so, we started talking, after they did that, we started talking to them about, hey, could you create a navigator hotline for people that were trying to get signed up for ACP, but clearly need one-on-one assistance. We did an event with Chicanos por la Causa, which was great, but again, also learned that not every family can take time off in the middle of the day or even early evening to go to an event to do sign up because they have jobs and they have kids, and it's just really hard. And by having this 24/7 bilingual hotline, we were able to allow people to kind of call at their pace and at their leisure to get signed up for ACP. The other nice thing about having the call center versus in person was that people could call back. So if they had questions about, okay, now I'm eligible, we've signed up, I've got my code, my verifier code from the FCC, but I have no idea what kind of internet I need or what speed or any of that sort of thing. And so these folks could call the navigators back, who they now have a relationship with, and they could help them determine what the best speed might be for their family or for their situation. So there was a lot of reasons why we felt like using a navigator hotline was really helpful. So that kind of goes into the first few bullet points. So some of the things that we learned is that obviously our goal was to reach the people who needed ACP the most. We also realized that you had to have trusted intermediaries, which is why Common Sense, ASU, the Digital Equity Institute, these were all organizations that we felt like people could trust. The idea of the navigators, as I mentioned, a lot of these households are completely disconnected, and so they don't even have really the skills needed to try to enroll in a government program themselves. So having that one-on-one assistance is really crucial. As I mentioned, the phone-based support allows those who are trying to enroll to use the devices that they have at their disposal. It may not be a laptop, it may be a phone, or it may not be a phone, it may be a Chromebook from their student's school, or whatever that might be. Plus, as I mentioned, it's more private, and they can work with the navigators on their own schedule. We also learned through the use of navigators and in the metrics that we collected was that Medicaid and SNAP were by far the most common enrollment pathways, and that there is a lot of problems trying to use the free and reduced lunch letter that schools are supposed to make available to families who could then use that as an eligibility document. Two out of the one of the reasons we were able to collect some of these metrics were because our advertising, we had several phone numbers that people could call in on. So if they heard about the ACP enrollment help through, say, Spanish language radio, that was 1-800 number. If they learned about it through a billboard and jotted down the number, that was a different number. Same thing with whether it was Spanish or English. So we had like 8 different phone numbers, so we could tell where the calls were coming from. If they heard it on TV, if it was a PSA that Cox had run, if they ran our PSA, there was a different phone number. So 2 out of the 5 callers requested Spanish language support. 3 out of 5 told our navigators that they had some discomfort using technology or online forms, like the ones that you had to fill out for the FCC benefit. 4 out of the 5 callers were not previously signed up for Lifeline or the ACP. And that was another thing that was very helpful with the navigators, is they were also able to inform the callers about the Lifeline benefit that was available as well. And then the other thing that we found, everybody was asking us, including the White House, was asking us for anecdotal stories and things that we could use to help market and promote the ACP. And that was really getting stories from individuals who had signed up and were now reaping the benefits of having more reliable, in most cases, faster internet. So that was kind of the navigator piece of it. And then in terms of the advertising piece of it, which not everybody could afford to do a marketing program like we did. And we just decided that we needed to really boost the awareness of the ACP program. So we, even as a nonprofit, just said, we're just gonna, you know, pay for it and see what happens. And then if we want to expand it, maybe we can get some funding. And so actually right now we're working with the city of Phoenix to do just that, to possibly see what we could do to help expand this to all of the city of Phoenix, the campaign. So we learned that the ads have to be simple, they have to be authoritative, and they must be mobile friendly. Okay, so anything that we're putting out there, people have to be able to see it and understand it very quickly on their mobile phones. Digital ads, so social media type ads and TV ads performed the best. Although there's still a lot of good to be said for a holistic approach, or for the idea that marketing executives will tell you that you need to have more than a couple of touches before people actually wrap their heads around what it is you're trying, what call to action you're trying to get them to make. So that was the reason for the layered advertising, for the billboards, for the light rail signs, for the radio ads, for the TV ads, for the PSAs, because you might hear about it or see it driving to work, but you may not remember to do anything about it until you maybe see the PSA while you're sitting at home in front of the TV. 50% of the callers only had their smartphones to connect to the internet, so that's problematic. We also learned that radio ads were underperforming for us. We actually shifted some of the dollars to television result. Did somebody have a question? No? Okay. We also created a website for this campaign that was extremely simple, easy to use, easy to find, getmyinternet.org, and people could get information as well as resources, digital literacy resources, and then also could go right to the FCC site where go right to the form that they had to fill out. We also learned that ads with trusted branding and authoritative language perform better. So what do I mean by trusted branding? In some cases, because we were partnering with the city of Phoenix, you know, we were able to use their logo on some of the advertising. They had put blurbs about the ACP for us in their water bills, which was really helpful. The mayor did a PSA, so that was great. And then we also learned QR codes generated literally no engagement. So, you know, they're cool for restaurant menus, not so cool if you're trying to get people to sign up for ACP. And then we also wished we had started earlier with working with the government agencies and transit agencies and with utilities and schools, because it can take a long time for anything to be. We should have known that. I think we did know this, but the ideas started popping up and it was too late to get a bus wrapped, you know, that had a ACP message on it and some other things. So we were lucky we got the phone bills. So just make sure that if you're going to do anything like this, you're going to get people on board early in the process. And then for us personally, it was a little bit tough. We think we could have had better numbers, just simply because it was during the elections. And so, excuse me, we had some competing advertising campaigns going on, right? So you had a lot of candidates campaigns, and there was just a lot of noise and a lot of stuff happening. And so some of our ads, I think, got lost in the fray. So that's, in a nutshell, what we learned. I have an entire presentation on what we did, more of a step-by-step kind of thing, and broke out some of the metrics and some of the questions that you might have, like, you know, people were asking us, like facts, I guess, FAQs. So if anybody wants it, let me know. I'm happy to send it to you. And Steve, if anybody has any questions, they can either ask me now or I can put my email in the chat, and they can reach out to me.
Sure. So Helena, just quickly, why don't you send me your full presentation, and then I will share it when I send out my meeting update.
Sure.
That's probably the easiest way for people to get it.
Sounds good.
Questions for Elena? Well, this, as you heard, that this is pretty relevant to the further discussion we're going to have today with Alan and with Dawn and DES. But before we move on, I saw Lupe. Aren't you there somewhere?
Yeah. Hi, everybody.
There you are. There you are. So if I can put you on the spot, Lupe, can you give us an update, just a quickie, that you guys got that $750,000 grant? Is that correct?
Yeah, 715 for the ACP.
That was close enough.
Yeah, that, hey, the 35,000 would have been great, and extra to help impact more lives.
So can you just quickly refresh people about the grant that you've got? And I don't know if you have any additional information about what you're going to be able to do with that money. I know you were still waiting to hear about exactly what it is you could use the money for.
Yeah, so we're still waiting. I know when
I'm sorry, Lupe, just a second. Can you just tell people Chicanos por la Causa, just quickly who you guys are? We do have some new people, and it's particularly relevant to the discussion we're going to have today. So please go ahead.
Alrighty, so hi everybody, I'm Lupe Valenzuela. I work at Chicanos por la Causa, also known as CPLC. We've been around in the community for 50 plus years. What started with 4 ASU advocate students to try to get kind of in the school system to make sure there was equality for us, is now we do services and anything you can think of, from babies, so infants, early childhood development to seniors. So we own our own senior complexes. We do integrated health and human services, social services, and education. We do real estate. We also do economic development. We have the first micro lending office here in the state of Arizona. And during the pandemic, we were ranked number 3rd for the PPP loans after Wells Fargo and Bank of America. We also have a program that helps with people who are trying to buy their home, first house time buyers. So anything you can think of, we have at CPLC, but recently during the pandemic, we started getting involved in digital inclusion because we realized that the community we're serving in the areas that we are, most of the families are low income and in poverty. So we wanted to support our community, and what started with a small, kind of distributing computers to a couple of programs has then evolved to what we are now. The ACP outreach program, we applied for was to be in 4 of our 5 states. We're currently in Arizona, New Mexico, California, Nevada, and Texas. But for the ACP outreach, we did do all of the states except Texas, just because there wasn't going to be enough funding, and Texas is really, really big, and we have a lot of our offices in the big rural areas, and the distance of where they were was a little too far. So for this, our goal is to be helping with in-person, on-hand support in our community. What we are looking at is we are going to be working in the areas where we have offices. So CPLC has over 150 plus offices, close to 200 across our states. And so we're going to be targeting those areas. When we were applying for the grant, we did look at the zip codes with the low ACP participation, and then we looked at the zip codes we were in. And so we try to align it to those zip codes to say, hey, we know there's low participation, and we have programs that have been there for multiple years. So we have that trust in the community, so we can go ahead and reach out to the community, work with our programs, because we have key program leaders that have been in that community, that know that community very well. So we can work hand in hand and help our CPLC community and the extended familia. CPLC, when you think of Chicanos por la Causa, we service everybody. It's not just Latinos. I think there is always some that misconception, but anybody that needs a hand up, we do a hand up, not a hand down, because we want to make sure that we're truly empowering them. And the services that they come to get at CPLC, it's always a full wraparound services. So our goal is, if they need, let's say, this device to go through workforce development, we have a workforce development program that can help them get a job. Maybe they're ready to buy a house, they can go through a home time buyer, or maybe they're in domestic violence situation. We have a Decolores center that helps with that. So our goal is that full circle to really empower the community. So we're really excited because we know that we can really support people. Our goal is to do it in both languages, English and Spanish, to help kind of a big community. I think in the Latino community, there are low ACP enrollments, just because, growing up in a Latino household, when you say something's free, or, they feel that, you're going to give your personal information, they're asking for my license, or if they don't have a license, they're asking for the matrícula consular. People can be really weary about it, because it's like, okay, like, am I going to get my personal information? Is someone going to be knocking at my door? And so with that trust, we have been able to successfully enroll families in ACP, and they trust us. They'll bring us their whole documents, like tax, all the things you can think of. They have a folder ready to go. And we're like, hey, we just need the following, but we have been able to work with our local, because in our programs or ISPs, we try to get a lot of the eligibility documents beforehand. We're working with the schools, so that way we can get those required documents, or if we're working with our community programs in those programs, because we have some housing programs that we have. And so we try to get those eligibility documents beforehand. So when we're at the event enrolling them, they can bypass that situation. This has been a kind of trial and error, but I think right now our model for that has been very successful. And so we are excited to hear more about kind of what things that have been accepted in the grant proposal that we did and we sent in. And so the FCC announced it a couple days ago, a couple of weeks, and Ilana was actually the one that let us know. So that was wonderful. Like, and so we'll see what has been approved, and from there kind of adjust our business plan, and we'll be in those 4 states empowering lives with ACP one day at a time. No, we always say we're saving computers one day at a time because we work in IT, but here it's going to be ACP that aligns with it.
Great. Awesome. Thanks, Lupe. You guys just blow me away every day about the amazing stuff that you guys do and your reach in 5 states.
In 5 states. And so we're in 5 states. Our goal is to keep expanding. We want to be in 7 states by very soon. And so we are also have an office in Mexico City and have kind of work projects in Puerto Rico.
Awesome. So, well, first of all, any questions for Lupe? So just FYI, I did talk to Robert Lupe, maybe he told you that part of our discussion relates to the conversation we're going to be having today with DES and Children's Action Alliance and so forth, who also has great outreach throughout the state. And how do we marry what you're trying to do, particularly since you guys didn't get your full $1 million and you serve all these different states in addition, that how can we provide synergy with the folks who are trying to get folks signed up or renewed for access. And so there seems to be, at least in my opinion, a potential real synergy here. And I know, Alan, I think you're going to talk later about some of your health navigators and where they are and what kind of things they're doing. And so I think there's potential for some real synergy here, and the opportunity maybe for you guys to save some monies in some ways and be able to use it if you can piggyback with some of what they're doing. So anyway, I'm very excited. I think there's some real opportunity for us to work together and to collaborate.
Definitely. Thank you so much. And, I think we always say partnerships are really big in helping fulfill the mission and really empowering lives. And, whether, through ACP or, medical, all of those items, partnerships are really what's going to help us empower those lives.
Great. So Gretchen, I see that you've joined us. Good. So I know it's the last minute. You want to just quickly introduce yourself?
You bet. Thank you so much. Gretchen Wolf with the City of Phoenix. I'm in the Community and Economic Development Department. And we are delighted that we're going to join CPLC as one of the recipients of the ACP Outreach Grant. We were awarded $700,000. I've got a meeting invite out to not only CPLC, but also to Promise, Arizona. And I also invited Navajo County as the tribal option recipient to talk about where can we work together, where can we avoid duplicating efforts so that we just don't make the media buys the biggest winners of all this money. So super excited about that. We're taking a 2-pronged approach with our outreach. One is to use the trusted resources. So lots of people don't trust government, but they do trust their librarian. They do trust their housing counselor. So we're working with our forward-facing positions to have them advocate for this position, for this program. And then we'll have a series of events. So every week there'll be opportunities for people to come to an info session and learn about ACP and the documentation needed to qualify. And then application labs where people know just every Wednesday they can go in the afternoon to one of our job centers and have someone help them with their application. And the second prong is using community organizations. And this is a lesson we learned with our small business grants during the pandemic. For the first small business grant program we used, it was just get the money out as quickly as possible. We joked that we were building the fire truck while we were trying to put out the fire. 34% of our dollars went to businesses in qualified census tracts. When we got more funding through ARPA, we wanted to focus on economic equity, and we started with tiered awards. So if you're in a QCT, you got 50% more, but we also used small dollar contracts with organizations like Raza Development or 19 North Alliance, because not everybody cares if Gretchen has something to say, but they care what the people they know say. So when we reach one of their trusted resources and they can spread the word, that helps us. So those are our two-pronged,
This is my
prong approach, and then our secret council approval to contract with Ilana and her team to help us with all of the good work that they did last year as the foundation for moving us forward.
Oh, yeah.
Great. So Gretchen, you kind of beat me to it because I was going to try to identify who all the different recipients were and convene a meeting with them. And so looks like you kind of beat me to it. But I think it's also relevant to the discussion we're going to have today, because now we have this outreach also to a lot of the other community organizations also. So I'm glad we made the connection and that you were able to join us today.
Yes, thank you so much. I'm so grateful to be here, and I'll be sure to share this with the others so that they can benefit from your expertise as well.
That'd be great. And if you have the contact information, I was looking for the contact information for the others. That would be really helpful.
Yep, happy to send that on.
Sounds great. Okay, so let's move on. Any other questions for Gretchen before we move on? So Nicole, I see you've joined us. So you have any updates?
Hey, sorry for being late.
No problem.
I don't really have any new updates today. I think I was just talking with Sandeep. He's going to try to join and give this group some updates. So I'm not sure if he's on the call yet or not. But
I don't think he is, but I know
I'll
he was
defer to
planning
him.
to be here today. So hopefully he'll be here soon. I hope. Okay.
Steve, Mark here.
Yeah, Mark.
Not NTIA, but USDA did just announce the next round of Community Connect grants. And so those are smaller community broadband grants. The cap's been raised from 3 to 5 million. I think there's 79 million total. I'll put a link in the chat. The applications are due in June.
Okay. Thank you. And I'll make sure that we get that information out, Mark. So let's move on to our other presentations at the moment. Nicole, do you want to say anything more about the input that NTIA is looking for?
Sure. So that's the request for comment.
Yes.
For feedback on the digital equity grants from NTIA. So not the planning grants that the state already has, but these are the competitive grants and the implementation funding. So that is a formal process, but it doesn't have to be a scary or off-putting one. I'll share the links in there, but they're looking for input from organizations, from potential applicants, from communities that are impacted in how that NOFO is being written, and it'll be rolled out as well. So those comments are due on May 1st.
Right. And I did include that in the meeting announcement for today, and I will again this week after this meeting.
Great.
Okay, well, let's move on to, yes.
Steve, this
Yes.
is Cindy. This is Cindy.
Yes, Cindy.
So I'm in the ACA office. Sandeep is not going to be able to make the meeting. He was called into another meeting, but he asked me to make a couple of announcements.
Okay.
So the Digital Equity Institute has been selected as the contractor for the digital equity planning phase. And so that decision is official as of today. And I was also hired to be the digital equity project manager for the BEAD and the digital equity efforts. So I just wanted to make that announcement.
Congrats.
Thank you.
Congratulations, Cindy.
Thank you very much. Look forward to working with everybody. This is my first day. It's really exciting to me. I should probably close this door. Yeah, it feels like he's putting together a really strong team, and it sounds really exciting, the direction this is going. Looking forward to working with Nicole, with NTIA, and just really circling the state, trying to get input for the planning process, and look forward to working with all of you. I'm going to go ahead and put my new email and phone number into the chat. And so look forward to anybody can reach out to me, and let's make this work for Arizona.
So Cindy, I don't know if you know exactly yet what that job entails, and a little bit about your, what that process is going to look like.
So brand new. And I, like I said, I was authorized to make 2 announcements, but I'd rather get some time under my belt so that I know what's appropriate to share, but it will be an open and transparent operation, and really glad to be part of it.
Hey, thank you. Again, congratulations. Okay, so let's move on to our main presentation today. And before I do that, so Jocelyn, I see that you are online, and actually I had been meaning to reach out to you because you've been attending our meetings, but I don't think people know that you're with DES, if I'm not mistaken, and you do outreach to the tribes, if I'm correct.
Yeah. Hi, everybody. I'm Jocelyn Beard. I am the department's tribal liaison, but I also oversee the Office of Tribal Relations out of the director's office, where we do the government to government relationship building and upholding our tribal consultation policy for the department. And so we work through, our office has a hand in each of our 7 divisions, and also with AZIP, which is our Arizona Early Intervention Program. So definitely we are communicating and advising in terms of our services that are being offered to tribal communities about how to best connect and get more information from our department, such as it's so huge, and what we can do and how we can have stronger partnerships with our 22 sovereign governments in the state. So that's kind of our big job. It's definitely something that we're hoping to get the word out there that we are available, and to be used as a support and resource for anybody wanting to work with the tribes, and also working in conjunction with some of the similar programming that DES has, and what you all do out throughout the state to work with the tribes. So thank you.
Great, thanks, Jocelyn, and this is certainly relevant also to the conversation we're going to be having with your other colleagues here with DES. And so with that, I'm going to actually make the transition and welcome April and Dawn, and then you're going to be hearing from Alan in just a little bit. But April, do you want to do a quick intro and introduce Dawn, and then we'll just turn it over to her to do her thing?
Yes, thank you, Steve. So April Jones, Department of Economic Security. Jocelyn and I are in the same Office of Community Engagement. I'm the Central Region Community Engagement Liaison, but since we don't have a Northern or Southern right now, I'm kind of doing statewide. Yeah, so happy to have been with you over the years and keeping up with what's going on. Joining me today is one of our community engagement liaison for the Division of Benefits and Medical Eligibility. And they do the Medicare, SNAP, the cash benefits. And so it was great that Yana mentioned the Medicare and SNAP are by far the most common enrollment pathways. And so perfect segue. Thank you for Dawn to talk about what's happening in our agency and give you a little more information about how that works in the Division of Benefits and Medical Eligibility, which we refer to as DBME. So Dawn, I'll let you take it away.
Thank you, April.
And Don, do you want to share? Do you have anything to share? Do you want me to let you share?
No, we
No.
Okay,
had slides, but we're not going to use them.
okay.
Okay, so as April said, I work for the Division of Benefits and Medical Eligibility for DES, and I know all of you want to know how DBME are assisting clients. Prior to February 1st this year, without an application programming interface, an applicant would have to wait a number of days to see if they qualify for ACP benefits or if they need to provide specific documentation to prove their eligibility. That process takes a lot of time and may have deterred clients from getting benefits altogether. So starting April 1st, our systems are utilizing the application programming interface with our federal partner systems. This is going to allow clients to receive confirmation within seconds if they're eligible for those discounts. So it's really exciting. The clients are not going to have to wait anymore. With this new process, a client submits an application via phone, Connect Arizona, or the Federal Lifeline verification website. Within seconds of submission, the interface system will determine if the client has an open SNAP, Access, or TANF case. Once verification is obtained, clients can go directly to their provider and ask about potential discounts through the ACP. So I don't have a long presentation, but I'm open for questions.
Don, you have developed, I believe, a flyer, or I don't know if you're using your flyer or somebody else's flyer, but I believe you've been working on a flyer to our presentation.
Oh yes, thank you. So our press officer is working on a flyer with graphics and design and our policy team. Once this flyer is completed, we're going to be sending those out to the 1,700 community partners that the Office of Community Engagement has. So the partners can notify the clients of this benefit and how we're working together for ACP.
Cool. So, and maybe you guys are going to cover this a little bit later, but so tell me about the how those offices. So if people come to those offices, will your people then be knowledgeable enough to be able to get them signed up, or how is that?
Yes,
happening?
yes, they will be. The clients have to apply online or by phone for ACP, but the interface is going to connect them completely with our systems and automatically determine if they're eligible for SNAP, Medicaid, or TANF benefits. So it'll automatically approve them through our interface. Now, just to let clients know, I'm sending out information to all of the staff within the Division of Benefits and Medical Eligibility to let them know about this program. We've already sent out one email blast to everybody, but once I get the flyer, we're going to send out another one. That way our employees are educated on the benefit and can let clients know you can apply for this benefit. Now that you're eligible for SNAP, TANF, or Access benefits, you'll automatically be eligible for this benefit as well.
Hey, any questions for Dawn? Going once, going twice. Well, as you can all see that
I
there's
think
some.
Gretchen has a question, Steve.
I'm sorry, who's that? Oh, okay. Was that you, Gretchen, that had a question?
Oh, she had her clapping
Oh.
hands. It looked like a raised hand, but she was saying, yay.
Okay.
So I started with a raised hand, but then Dawn answered my question
Oh.
without me even having to ask.
Perfect.
So she's that good.
Okay, well, if there's no more questions for Dawn, let's move on to Alan, who can probably take the next 2 weeks to talk about what he's doing and all his connections. But Alan, you want to introduce yourself, and do you need to share? I think you had some slides you wanted to share.
Yes,
So please go ahead.
I just put them up. My question is, are you seeing the presentation side or are you seeing the full screen side?
Not seeing any slide yet.
Okay, you know what? I need to go back and try something here. You know, when we were talking about not being able to use 1% of the available power of my cell phone or Excel or anything,
There you go.
I'm it. Now, are you seeing full screen or just partial screen or what?
Just partial. You're
Okay.
showing, yeah,
What I need to do then is to,
you want to show the slide.
yeah, I just want to hit this.
Yep, yep. That's
Now
what
what
you
do
want. There you go.
No,
Okay,
that
good.
shows your notes. We're still
Yeah.
kind of
Okay,
partial
you show on the
screen.
notes one. I need to switch from one screen to another.
So Alan, I would suggest you
Yep.
start your slideshow first and then share your screen.
Oh, okay, let's do that. I've got it. No, that's how I had it. So I've got multiple screens. So my problem is I never know what screen is going to pop up because again, I'm an old retired guy and I sometimes forget. Now, what do you see? Same thing?
So if you click on display settings up in the top, you should be able to swap which is on which screen, and then we should be able
There
to
it
see
is,
the
yeah.
presentation. Yeah, so swap presenter view, and
There
then
we
we'll be
There you
good.
go.
Perfect. You got
Thank
it.
you. Thank
No
you so
problem.
much, Aaron. That's why you're a digital navigator at the library.
No worries. Happy to
So,
help.
Very quickly, because I'm going to go through some slides very fast, and then we're going to take some time and have a discussion. I am contracted with the Children's Action Alliance for the project of the unwinding of continuous enrollment. Very simply, 600,000 people are at risk of losing access. And I'm talking about Arizona healthcare cost containment system, not other kinds of access. And there are people on the call today that know more than I do. It's just simply that I'm helping to coordinate getting the word out to many community organizations. Before I retired a year ago, I worked for 12 years in the area of helping low-income people get access, or the Affordable Care Act, or SNAP. So the issue, I'm sure most of you have seen this in many different ways, but during the pandemic, all Medicaid agencies in the country were not allowed to disenroll members. So the membership here in Arizona in access grew by about 1/3 to about 2.25 million. I remember when it was well below 1 million, and continuous enrollment ends in just a week, and access must renew all of its members. Access estimates about 650,000 people are at risk of losing coverage because over the past 3 years, we don't know, I shouldn't say we, Access doesn't know who has moved, who is still in the state, who's gotten other benefits. According to Access, the roughly 650,000 can be divided into 2 buckets. About half have simply not responded to any attempts that Access has made by mail, email, text, and they've even done some phone calls. We don't know, have those people left the state? Do they have employer coverage? Access doesn't.
Just to clarify, 650,000 in Arizona, if I'm not mistaken.
That is correct. So roughly 325,000 are in this category if they've not responded to the attempts. And I have to be fair here because when I say access eligibility is managed by the people that are on the phone from DES. most people don't know that because Access is a medical program, but DES does the eligibility work for most of the programs. Also, about half of the people, 325,000, are most likely factually ineligible. And what that means is they may be over income, or for some other reason, they are no longer eligible. So we have these two groups, but we have two challenges. The first is, what can community groups do to help Access and Kids Care members retain coverage? Because if Access can't find you, you will be dropped. So this first hurdle is simply to get people to update their information, contact information. Then the second challenge will be, if somebody is not eligible for Access, then they can move into the Affordable Care Act and get subsidized coverage that is very affordable, but it's not the same as Access. So there's a lot of consumer education needed. So it's important. Well, I like to talk about children because I'm working with Children's Action Alliance. Children with health insurance do better in school. Multiple studies. Healthy kids do better in school, and kids that have health insurance are healthier. About 49% of our 1.74 million children in Arizona that are under the age of 19 get their health insurance through Access. That is a huge percentage. Also, about 36% of the 650,000 people that are at risk are children. Something to think about. Access with DES, this is the kind of messaging they're using. And I'm going to ask Steve to send out the slides so you can then click on any link that you needed to click on and see what's going on. But again, the first step is update your information so we can find you. That's the most important thing. Then I just wanted to point out that people that are on Access may not know that DES does eligibility. So the envelope that will arrive in their mail say if they're continuing to be eligible, if they need to provide more information, or if they're no longer eligible, it comes from DES. So we are trying to inform all of the community partners that are using the system to help people enroll that you should be telling your clients to look for a DES envelope, not an Access envelope. Our messaging is that help is available. And if you want to connect with a sister, and I'm going to define these terms in a minute, you can call Cover Arizona. It's a broad coalition, and we have people all over the state that are trained that can help with both the Affordable Care Act as well as SNAP, TANF, and Access. They are bilingual, no cost, and you can see the information. Just to make the point that people that are just a little bit over the Access income level can actually qualify for a no monthly charge plan from the Affordable Care Act, or most people that actually shop in it can get a plan for $10 or less a month. That's not all people, but it's most. When we think about where are the hot spots, this analysis was done by Vitalist Health Foundation. And on the left, you see the obvious, where are the greatest number of people? What's a little bit different is if you look over on the right, you will see communities with the highest percentage of people on Access and at risk in the state. Now, Oatman, its population is under 100, but 58% of the people that call at home receive their health care through the Access program. A lot of these on the right are rural, which ties into your ACP programs. Many of them are tribal. So I'm glad that Tribal Liaison for DES is with us today. We also, again, there's a link here when you get the slides, if you want to figure out where some of these locations are. And these are resources. Access has a whole toolkit for getting the message out, whether it be at your library or at your school or any other kind of organization. Children's Action Alliance also has a toolkit with memes in multiple languages. Again, to cover Arizona information, what a consumer can call 211 to get connected to cover Arizona. But if you dial the 800 number, you have one fewer person to speak to. You get connected to the trained person quickly. And the Centers for Medicare and Medicaid Services have lots of information. And about 3 weeks ago, the Arizona Republic did a really good article with facts about what this is all about. So these are resources. So my question really is where can you find potential partners for digital access with the kind of assistance that I'm more familiar with? So definition of terms. Healthy Arizona Plus, or some people call it HIA, is the online portal, that Access has, and you can sign up for Kids Care, SNAP, and TANF on that system. We use the term Healthcare Application Assister, but it is shortened to simply say assister, or not HAHA, but just HAA. The idea that these people are trained to help with health applications for government benefits and programs. If you go to Wildfire, which is Wildfire Arizona, they have SNAP grantees. These are grantees. DES gets the funds, they distribute them to Wildfire, and they have many partners all over the state. And these grantees have people that help people focused on SNAP, but also, since it's the same portal, for Access and Kids Care. And the largest number of these would be found at community action agencies and community health centers. Now, some assisters are trained to use healthcare.gov, call it Obamacare, Marketplace, whatever you call it. But most of those that are trained both for Access and healthcare.gov are found in community health centers. Now, there's the official term of health insurance navigator. The only people that can say they are a health insurance navigator must be affiliated with a CMS Navigator grantee. And the Arizona Alliance for Community Health Centers, my former employer, I ran that program until I retired. AACHC is the only navigator entity in Arizona. So they have many sub-grantees, and these people are also trained to use Healthy Arizona Plus, as well as healthcare.gov. The bottom line, whether you're just saying navigator or assister or whatever, they all work with low-income families across Arizona. Here you can use a link when you get the slides that will take you to the Arizona Alliance of Community Health Centers, and you can find where federally qualified health center sites are. There are 23 organizations, but they have over 150 sites across Arizona. The Arizona Center for Rural Health, which is housed at U of A, they have a link, and you can find where the critical access hospitals, these are basically very small hospitals in rural areas, and where the Indian Health Service locations are. Some, but not all, of these critical access hospitals and IHS locations can also help people with renewing for Access and SNAP, so on and so forth. Wildfire has this map that tells you where their SNAP enrollment and outreach sites are. Arizona food banks have also a means of finding food pantries. We only have about 5 or 6 major food banks in Arizona, but we have like 1,200 distribution sites. And it's these distribution sites, the pantries, that have a lot of face-to-face contact with low-income people in rural areas. And also U of A Center for Rural Health created a map that shows where DES maintains offices in the state. So these are resources when you are thinking about who else are some of the community partners that might be able to help you advance your goals. Now, let's just stop here and see how I can help you or what questions you have. We can talk about how you might interface with this other community of navigators and assisters that use digital means. Or we can talk more specifically about this unwinding. So thank you, Steve. And there's a few people on the call that I've already connected with. Thank you. I'm here to help you.
Great, Alan. That was really awesome. And it's exactly what I think we needed to hear today. So really appreciate it. So questions, comments for Alan? Oh, come on. I know you have questions.
Okay, I see a question in the chat, and that is that are do these two groups overlap? And I think that one of our people from DES might better be able to answer that than I can answer it. It was described to me when I spoke to Access is that they are intended to be exclusive groups and not overlap, but I don't know factually if there is a segment that overlaps. Can anybody from DES help us?
I think Dawn may have dropped off.
Okay.
Because she was having some computer problems and April had to go.
Okay, well,
If anybody else from DES.
I can get the answer for you, Steve, and give it to you, Steve, and you can put it out, okay?
Okay. So Alan, you want to stop sharing for a minute, please?
Sure, I'm happy to stop sharing. Everybody tells me I talk too much anyway, so.
No, you did not. You did
Let me
not.
just, I think that's there. That should do it.
We're still seeing your screen.
Oh, okay. I hit stop sharing.
Alan, I have a next step serving question for you. This is Erin from the State Library. We've been emailing back and forth a lot about that PSA that we'd like to put out to help get this word out. I was just wondering if the final version of the flyer got finalized today.
Yeah. They are working on the final version at Children's Action Alliance today of the consumer brochure.
Okay.
The wording that I have sent you probably won't change. They're working, the communications team is making it look pretty.
Okay. Okay.
But the facts that I have provided are right out of Access's materials. Step one, update your information. And step two is expanded a little bit beyond what Access has, but they do use Cover Arizona as the referral. So you can start working.
I'm just waiting for the PDF so that the libraries have a printable, but I appreciate that update. Thank you.
I'm hoping tomorrow.
Okay, no problem. Thank you.
No.
Yeah, this is Cindy Hogan.
Hi, Cindy.
Yeah, I know it's important to get the word out, and as was said in the chat, that's a lot of information. That's a lot of information for us. Never mind the people that are going to be getting this and trying to negotiate all these changes in paperwork and processes. And my concern with ACP is that we are putting out the word that it's available, but we still need a lot of work on how we're going to get people signed up.
Right.
It's really it's really I've done the sign up. It's a hand holding process versus just run along and do it yourself kind of thing. So we really need a strategic plan about that beyond announcing that this is something that's available if they're interested.
Cindy, thank you for saying that, because at the front end of the Affordable Care Act, it was announced, but the process of how. So it has taken years to kind of institutionalize that by whatever name you call
That's right.
it. So my point is that what Ilana was saying earlier, trusted spokespersons, that is so important. And is it Ilana or Lana? I can't quite see the screen.
It goes Elena.
It's Elena.
Okay, Elena, but thank you. From my own 12 years of experience, I will validate your findings. I never had the data, but I can validate trusted people. People use handhelds And if you are trying to use systems that are not handheld friendly, it's just so difficult. But I would, to Cindy and what she's working on, Gretchen, as well as the CPLC lady.
Yeah, Lupe.
Lupe. There are certain groups in the state that have the health application assisters, there you are, Lupe, that might be very well positioned. Now, CPLC now has an ownership relationship with the Keogh Health Foundation, or Keogh Health, and I used to be the CEO there. And they have a whole cohort of assisters, and they would be the first place, Lupe, to start talking to see, because they already have regular office hours in Somerton, probably, as well as San Luis and some other locations in the rural areas. But there are other organizations similar to that. So what I would suggest is, Steve, I would be more than happy if there's a small subgroup that wants to discuss further putting together a meeting with some of these key players in different parts of the state to have a discussion, because some of them may not even know what ACP is.
Right.
I thought it was a test I had to take to get into college, but I think that was ACT. But
then the other thing that's needed is will be training for, because the assisters, and it's interesting, I remember when ACA broke, and that was the first time I ever heard the word navigator. So when I joined this movement and heard navigator, it made perfect sense to me. And but like I say, we have lots of people producing flyers. We don't have the training on that same level, and the training for at least a couple people in each organization. I've been saying that since this thing broke, that we really need that. It's not just trust, it's the skill of walking through. It's a complicated process, and you have to get things right.
Well, if whoever needs to take the lead on that aspect, if Steve knows you, and I'm just getting acquainted with you, Steve, shoot me a list of 3 or 4 people that need to be connected.
Well, Alan, that's already in the works.
Okay.
So
and I will personally set up opportunities for them to connect with some of the individuals that will have influence over the largest number of assisters.
Yeah.
Because you're looking for pilot projects in some cases, as well as regular implementation.
So Aaron, who you know, and Mauricio, who you also know, who actually directed me to you, have kind of stepped up to take a lead in us moving ahead in bringing folks together and trying to figure out what's the next step in this process. And again, I think we had already begun to identify a handful of people to start with. Obviously you and Don and a few other folks, certainly CPLC and other key folks particularly. And is Gretchen still here? Is she gone? There you are, Gretchen. So Gretchen, if I can just move on for just a second, how does this fit with what your interests are, and how do you see that this might dovetail with the other groups in that discussion?
I think it definitely dovetails. I love the idea of making sure that if we're going to make contact with someone, that we're making the most of it and giving them all the information they need. So, we'd be happy to figure out how to share that too.
If I'm not mistaken, at least I know Lupe, what you guys are planning to do and have been doing is getting navigators trained. And we have been in touch with Lyle with the FCC. And he is very interested in coming to Arizona. He's very interested in providing navigator training. Don't know what that looks like yet. And it probably isn't just one time. It might be multiple times. It might be online. It might be in person. We don't know that. And so he's going to be a part of that core group to begin to map this out. I think to pick up on what Cindy has been talking about is that we need to be able to, if we're going to, Alan, to connect with some of your quote navigators of how do we get them trained in this piece of the puzzle. And so I think that, because again, we don't want to just put the information out there, but who's going to actually help them walk through getting signed up? And I think that has always been a weakness of ACP in the past. And so again, we have a lot of key people, Elena's group, obviously, and a number of others. So that's kind of where we're planning to go, Alan. And Mauricio and Aaron, I don't know if you want to add anything more to that.
Not much has changed as far as the conversation since the end of last week, but the flyer that I referenced was the plan was to put it in front of the library staff in the state so that if their patrons come to them with questions, they have something and they're not scrambling. So this wasn't to go out to, you know, a huge wide group or anything like that. So I apologize, I didn't give that context. But from the FCC mailer perspective, I am waiting to hear back yet as to whether or not the Experience Center at ASU /DEI is able to have their contact information on the flyers from the FCC, as well as the Connect Arizona Digital Navigators that is a project of the State Library. But to the point that everyone is making, that's still a finite number of people that would potentially have to field calls from those, you know, many people in the state who might be reaching out. So it's a very valid point. And to help with that, sorry, reading while talking is never a good idea. Too much going on in the chat. To that point, the trainings that the FCC has offered us, both in person and potentially virtual, will go hopefully go a ways to educate library staff and other people across the state as to how to navigate through the ACP sign-up process.
I just wanted to jump in there. And one thing is, I was not aware of the program interface that Don was speaking about. It sounds like once that's tested and we know that it's working, that could simplify the whole ACP sign-up, because it sounds like it will be one place and you get the results for multiple things. And that may or may not become the primary gateway for you. So I am going to reach out to Don so I can get a little bit more, I need to go a little bit behind the curtain to understand a little bit more about what that is. The other thing is the individuals that do use Healthy Arizona are very good about figuring out how to use systems. Because if you can use Healthy Arizona for multiple programs, or if you can use healthcare.gov, you can adapt to other programs because you're a digital navigator, even though that's not your title.
If I remember correctly, that the FCC supposedly is trying to make this process easier. I guess we have to wait to see if that will actually happen. But and I don't know, Elena or Cindy, if you guys know anything more about that.
Well, it sounds to me like what Dawn was talking about is, and unfortunately she's not on the call, but you know, the federal government does have a gigantic database of people who can get accepted very quickly through Medicaid and SNAP. It sounds to me like what Dawn was talking about is a very similar database that at least, or databases that can talk to each other, so that if you already have SNAP, you can very easily get become eligible or be made eligible for these other, I think she mentioned Access and TANF, but ACP sounds like it might be in there as well. So that to me is what she was talking about, which would be great. If anybody on the call knows something different, let me know, but that's what it sounded like to me.
No, that's what it sounded like to me too, Elena. And I think that would be something great, because as Alan mentioned, if you use Healthy Arizona, it screens you for like 4 different government programs. Why not add one more as ACP?
Exactly.
And I think one of the biggest challenges that she also mentioned is getting verification from the schools. For some reason, that's a big hurdle. I don't know if something can be done. I know that the schools participate in this call from time to time, and I don't know what they can do to simplify that process. Because all of the Title I schools should be able to
Yeah.
qualify automatically.
So I can go into a whole half hour, Mauricio, just talking to you about the schools and what the situation is with the schools. So yeah, if you don't have to get your eligibility through the schools, it's better because it is 50 times harder to try to get it through the schools because of the requirements. We've talked to the FCC about this. We've created templated letters that could be used by school districts. We have tried a number of different things and nothing has worked at this point. So I would argue that if you don't have to get your eligibility through your Title I status, your free and reduced lunch status, don't use the other passageways if possible.
So Alan, Mauricio, even the folks with the Department of Education have difficulty getting information from local school districts. So
It looks like Paul has a bunch of questions, so.
I have a couple of questions, yeah.
Go ahead, Paul.
And I think I'm gonna do the round robin. I've got at least 3 questions for at least 3 different people. So Alana, when you were talking about the schools, is it because it's not being put in the appropriate format for them to use? Is that the crux of the problem?
Yeah, the crux of the problem is that every school, okay, and you've got X number of schools within a district.
Yep.
They have their own letterhead with their own information on the letterhead. Simple stuff, the address, the phone number, the child's name, the grade. It's all very specific to the school, but then you got to fill in the blanks. And there's nobody at the administration level at these schools, go figure, who can do this. So even when we tried sending a flyer home with the navigator phone number on it so that parents could call the navigators, the schools were getting the phone calls and threw up their hands and said, we're not doing this anymore. And this was just in one district that we tried to do it with.
And what you're talking about is nothing more than data matching and a very efficient mail merge with the right template. Right. Okay. So that's your question that I had. Erin, you're talking about the flyers that you're getting from the FCC. I know they're coming in different languages. Are there specific languages that you're seeing for different areas? Because that information might be very helpful for, in general, just outreach, knowing that, hey, this area over here is looking for XYZ language, but over here, that language is not being asked for. That sort of information, if you've got that by library, that would probably help the overall team here in terms of knowing that, hey, for this area over here, we need it in I don't know, pick whatever language you want. There's a myriad of them, except for Australian, it doesn't appear. So you just pick a language, right? But I think that would help if we were able to know that.
So I wish I would know that too. Unfortunately, when we sent out our pre-survey and we have a list of county librarians and library directors, and these are very busy people who can't always, respond to things. I only got about half a dozen responses for specific needs, and none of them wanted anything other than English and Spanish, except for one of the state agency departments, the Talking Book Library. They wanted large print and Braille, which makes perfect sense because their goal is to serve low vision. So unfortunately, I don't have any more information than that. And basically the approach that I took, knowing the demographics generally of Arizona, was to send English and Spanish to everybody. So unfortunately, I can't give you much more than that. It will be interesting though, once they have it, we might hear back, oh, it would be great if we had X. And then we can work on that. One really great thing is now, of course, not on a large scale would any library necessarily be able to do this, but there are printable PDFs right on the FCC's toolkit where you can download it and print it as necessary if you need it, and so if for a library, for example, if we ended up with a customer who identified a unique situation, we would be able to potentially solve the need. But it's going to the website, printing it off, having the funds and the capabilities to print, et cetera, et cetera. So I'm sorry, I can't give you more than that right now.
No, Erin, that's good all the same. And thank you. And then Alan, I put a few questions in the chat, but
I
You
see 'em.
mentioned with the
Mhm.
number of people who are going to be getting dropped, and you've highlighted the hotspots. The hotspots are all very city-based. Are you able to get any more granular that, like, for instance, census tract or census block, that still retains anonymity, but shows where are the areas of need? I'm just wondering, is that possible?
Maybe, maybe not. So let me back into the answer, Paul.
Yeah.
When we were doing maps to find high level of need for people to enroll in Access or Affordable Care Act, but a low number of assisters, again, Vitalist was able to put together those maps. But where it kind of falls apart is census blocks become pretty big geographic areas out in the rural areas. We could really pinpoint in the cities that, west of this street and south of this street is really an area of need. But it's hard to do that in the rural areas. And the thing is that there are so many layers to this. Access DES is, of course, sending communication to every single person, and they're doing it in batches over several months. Mauricio can speak to this, but of all of the Access health plans, they're private insurance companies, they are reaching out to every one of their members. So Access and the health plans can go one-on-one to reach, the individuals.
Mhm.
We're kind of more of everywhere, everything all at once, trying to get them to borrow.
We're watching movies.
Right. But we're trying to, connect with the community groups because it goes back to trust. Who do people trust? Because in Arizona, a huge percentage of the people, I don't know exactly what it is, have mixed immigration status homes. So the fear factor comes in about who do you work with? Now, Lupe's organization has 50 years of history and is a trusted partner, but that they're not the only trusted partners in communities. So the question is, where is the trusted partner in some of these communities that are so hard to reach? The other thing is that even though the numbers are not great, we have many subpopulations of Asians. We used to work with people from the Marshall Islands because they had different rules than anybody else on earth when it came to federal governments because the treaties they have, but they also speak a different language. So community partners and trust, and I know I'm begging the question, but we won't be able to go in this time frame deeper data.
Yeah.
And we also don't have the resources to target it. We're doing some digital ads, but that's again a broader targeting based on demographics, but not a tightly targeted. I don't know if that.
I think you're sharing a common challenge that we've seen with any of the programs that people are trying to roll out, that people are trying to support, trying to activate people on. It does roll back to trust and people Otherwise, I mean, the populations that we're talking about, unfortunately, have been the target of every unscrupulous, scam and activity out there for so many years. That trust is the gateway through. So no, but you're highlighting the same problems that I think everyone else has seen.
So I'm sorry to interrupt, but I have to take my son to the airport. I have to leave in about 5 minutes. So he will not be happy if he misses his plane. So just quickly, we are gonna do a follow-up meeting with some key folks. And it seems to me that one of the things we need to start to do is to just map out. So where's the potential partners? Where's the potential navigators? What kind of information do people need that we can provide? And the other piece that comes up over and over again is navigator training. And we have people here in Arizona, and we have access to Lyle and folks with the FCC. And so, to me, those were some of the key, not everything by any stretch of the imagination, but some of the key things that for me seem to evolve. So any other questions or comments before we end for today? Well, Alan, you did just what I expected you would do.
Nice to know it happens once in a while.
So I think there's great opportunity. And again, Gretchen, I'm glad you really joined us. And I obviously that you and the other organizations, and of course Lupe and all, fit right into this whole key discussion here. So I think we're hopefully heading down the right track. All I have to do is figure out how to pull this all together.
I'd like to say I'm really jealous of Aaron's coworker there. Jealous, Aaron, your little coworker.
He's a new coworker. He just joined our family on Friday. This is Aries. He's a miniature golden doodle.
Oh, that's awesome.
And I moved my office to his pen today so that, we could get to know each other.
Too cute.
Beautiful.
The reality
Thank
is
you.
that, Aaron, you are the service person for the dog.
Yeah, very true.
Support.
This is very true. I'll get him signed up for ACP. Don't worry.
Okay, everybody. Sorry, but I got to run. Thank you all
Bye.
for being here today. Good meeting.
Thank you.
Bye, everybody. Cheers.